you've been diagnosed with overactive bladder, you've done all of the first-line therapies. You've changed your diet, you've moderated fluid intake, you've even done pelvic floor exercises, but you're still suffering from overactive bladder. Well, today I want to talk about overactive bladder medications and what you can do to take the next step to take control of your overactive bladder. Overactive bladder is very different from many of the problems that are treated in medicine, such as diabetes, asthma, or high blood pressure. Overactive bladder is not a disease. It's a collection of symptoms. By saying it's not a disease, I don't mean that overactive bladder isn't sometimes very serious. In fact, it can be devastating for some patients. What I mean is, unlike many other diseases, the goal of treatment is not curing a disease. The goal is to treat the symptoms. Unfortunately, we don't have a cure for overactive bladder. Instead, what we have are effective treatments for the symptoms. I think this is an important difference. What matters with overactive bladder is your satisfaction, your symptoms. When you take a medicine for high blood pressure, the goal isn't about satisfaction, it's about lowering your blood pressure. But in overactive bladder, only you get to decide whether your symptoms are improved enough with therapy. Your satisfaction is the goal of therapy. Do you really have to take an overactive bladder medication? It seems kind of funny to have a doctor ask that question in the middle of a video about overactive bladder medications. But OAB is not life-threatening. So whether you're being treated with behavioral therapies, medications, or even no treatment at all is really mostly up to you. And it can depend on a lot of things. It may depend on how severe you feel your symptoms are, how much they affect your life, or maybe just how you feel about medications. Overactive bladder often has an impact on people who have other medical problems like diabetes or high blood pressure. Overactive bladder can make these problems harder to deal with. And this may be a good reason to try an overactive bladder medication even if you have some of these types of symptoms. However, overactive bladder medications can also have side effects. And some of these side effects can be more of a problem if you're older or if you're already on other medications for other diseases. Both the benefits and the risks of taking an overactive bladder medication need to be considered before starting therapy. You may have relatively mild overactive bladder symptoms. You may feel that the time, the effort, or the side effects, it's simply not worth it when you consider those against the symptoms that you're having. And it's never wrong to try a more conservative therapy like behavioral modification or pelvic floor exercises before you start a medication therapy. There are a number of different medications that can be taken to control overactive bladder. Some of the common brand names you may have heard include Ditropan, Detrol, Vesicare, Toviaz, Sanctura, Myrbetriq, or Enablex. There's even an over-the-counter patch called Oxytrol for women, as well as a prescription gel called Gelneek that are actually applied to the skin instead of taken by mouth. Most overactive bladder medications work by blocking certain nerve receptors or nerve endings in the bladder. These medications are called anti-muscarinics because they block a receptor in the bladder called the muscarinic receptor. Unfortunately, the bladder is not the only location where we find these muscarinic receptors. We also find them in the mouth, the eyes, the intestine, and the brain. And these locations of other receptors help to explain the common side effects of overactive bladder medications, including dry mouth, dry eyes, blurry vision, or even impaired thinking and memory in some patients. Because the medication is acting directly on the bladder, difficulty urinating and even urinary retention is another possible, although very rare, complication. One of the most common questions I get from patients is, which of these medications is actually the best for me? Well, that's also one of the most difficult questions to answer. First of all, there are actually very few studies in which one medication is compared directly to another medication to see which drug actually works better than the other. And even when these comparisons are made, the studies generally don't show any difference in how effective these medications are versus another one. There are differences in the side effects, however. The older medications, which have been around longer than I've been a doctor, are associated with higher rates of dry mouth, dry eyes, and memory and thinking effects. There may even be an association between some of these medications and dementia with long-term use. There are also good reasons to take an overactive bladder medication that is released more slowly, called an extended release, rather than one released quickly, called an immediate release. Dry mouth and constipation are much less frequent with these longer-acting drug formulations. Also, patients are more likely to take a drug that's prescribed if it can be taken once daily, instead of with multiple doses like we do with the immediate release formulations. Particular patients may have a specific reason not to take a particular type of overactive bladder medication. Patients with a type of glaucoma called narrow angle glaucoma are at higher risk and should mostly avoid the antimuscarinic medications, though they can take a medication like myrbetriq, which is not an antimuscarinic. If a narrow angle glaucoma patient is going to take an antimuscarinic, they should probably be followed more closely by an eye doctor to recheck their eye pressures. Patients with existing memory impairment or dementia may want to avoid some of the overactive bladder medications as well, particularly the older drugs. If they are going to take an overactive bladder medication, they may want to find medications that tend to avoid an effect on the brain, like myrbetriq or even trospium. These drugs either don't have any impact on thinking or have difficulty crossing from the blood into the brain. Patients who already have issues with constipation, dry eyes, or dry mouth, or who have had these side effects with other overactive bladder medications, may also want to use medications with lower rates of side effects. Patients who have a history of not emptying their bladder, which we call urinary retention, may want to avoid overactive bladder medications altogether. For many of my patients, the best overactive bladder medication is actually the one that's covered by their insurance formulary and therefore is more affordable. You simply can't take a medication that you can't afford, and any drug is not going to be very effective if it's sitting at the pharmacy. Most of my patients want to know how long will it be before they start to see improvement on a new overactive bladder medication. The time before you should expect to see some improvement can actually depend on the medication that you're taking. We often talk about something called the terminal elimination half-life. That's a very fancy way of saying how long does it take half of the medication to be eliminated from your body, usually through the liver or the kidneys. It also tells you how long the medication will take to reach a steady level in your blood. It usually takes about 5 times the T1/2 to reach that steady level. For quick-acting medications like oxybutynin, the T1/2 is 2 hours, meaning that the medication has already reached its treatment steady dose after about 10 hours. That's when we would begin to expect to see some improvement. On the other hand, myrbetriq, another overactive bladder medication, has a T1/2 that is nearly 50 hours. That means it will take over 10 days before the medication reaches that steady state level, and it may be at least that long before we start to see any effects from the medication at all. It can get a little more complicated because multiple studies on overactive bladder medications show that patients continue to see an increasing benefit on medications even weeks after the medication has reached that steady state. Therefore, an overactive bladder medication should generally be taken for about 4 to 8 weeks to work before it's considered a failure, unless severe side effects force us to stop the medication. So, what can you do if you've taken several different overactive bladder medications and still are not seeing any benefit? You probably have what we call refractory overactive bladder. This is when you have not seen a satisfactory response to multiple medications that have been taken adequately, about 4 to 8 weeks each. This also applies to patients who cannot take a medication due to side effects or other medical issues. It's generally advisable to try more than one medication and even more than one dose if possible, because you might have different responses to different overactive bladder medications. But with each new medication, you can become more frustrated. If you have refractory OAB, you should see someone who specializes in bladder health, such as a urologist certified in female pelvic medicine and reconstructive surgery. Why? Well, first, because a specialist in bladder health can perform a more thorough evaluation to be sure that OAB is actually the cause of your bothersome symptoms. It can take years of experience in this area to know what else to look for to be sure that it isn't something other than overactive bladder. Perhaps just as critical, as specialists, we have more to offer beyond just first and second line therapies for overactive bladder. Third line or advanced therapies for overactive bladder can be very effective even in patients who've seen no real response to multiple prior medications and behavioral therapies. Well, I hope you found today's information valuable. Please know that on our website at www.oabclinic.com, we have even more information about overactive bladder, incontinence, and lots of other topics related to pelvic health. Or subscribe to this channel and be notified when we come out with videos with more information about taking control of your bladder and pelvic health in general. Thank you so very much, and look forward to seeing you again on another day.